Hello everyone, welcome to my YouTube channel. My name is Onesimus and you're on Onesimus the Fashionable Nurse. In this tutorial, we are going to look at phases of nurse-patient relationship. Phases of nurse-patient relationship. Remember in my previous video, we looked at components of nurse-patient relationship. And for those who still want to watch that video, I've provided a link in the description down here. Please click on that link, it will take you direct to the video. And please, if you know you are new on this channel, please subscribe by hitting a subscribe button in the corner down here and click on the bell which has two arrows on top so that you'll be the one to receive the first videos whenever I post. Thank you. So we are looking at phases of nurse-patient relationship. I'm going to first define nurse-patient relationship. Yes, we defined it in the previous video, but for good understanding, I'm also going to repeat it from here. A nurse-patient relationship is a professional and therapeutic relationship between a nurse and a patient that is aimed at improving the health needs of a patient. And this relationship it doesn't come just in a short time. It comes after several interactions of a nurse with a patient. And phases of nurse-patient relationship. Number one, we have pre-interaction phase. Pre-interaction phase. In this phase, this is where the nurse has not yet met the patient. Actually, in this phase, a nurse prepares to go and meet the patient. So the nurse's tasks in this phase are collecting data about the patient, including the biographic data and the occupational data. This one will help you to know the type of person that you are going to involve in a relationship. Then, secondly, after knowing the person, everything about the person, also identify your own feelings and emotions. You know, you are someone who is short-tempered and you're going to deal with someone who is tough. You'll be knowing on how to control your emotions. Then, thirdly, after identifying yourself, after also collecting data about the patient, now set the goals depending on the data you have collected before you go and meet the patient. This one takes us to the second phase. The second phase is called orientation phase or introductory phase. In this phase, this is where a nurse meets the patient for the first time meeting with the patient. The nurse's tasks here are create a report, introduce yourself to the patient such that he or she can know you, and create the situation that will help the patient and trust you. For example, by ensuring them that all the information that will be shared between you and her will be confidential. They will help the patient to trust you. Then also establish effective communication. This one can be done by using the language that a patient can easily understand. For example, if possible, you can even use a local language, if possible. Now, after the patient has entrusted you, collect data about their feelings, emotions, weakness, and strength. This one can be done by allowing them to explain about themselves. And for you, you listen carefully. As they are explaining, identify the key problems and look for the intervention. And also discuss with them about the goals. Discuss with them about the way you're going to solve their problems. Set goals mutually. You set all of you involved in setting goals. You and the patient involved in setting goals. This one will help both of you. It will help the patient to get treatment, and also it will help you to meet your goals, because the main goal of a nurse-patient relationship is to make sure that the patient improves. So by involving the patient in the management plan, it will help both of you, like the way I've explained. Now we go to the third phase, which is the working phase. This is the phase where most activities are implemented. The nurse's tasks in this phase are continuous collection of data from the patient. Continuous collection of data from the patient so that you can identify most stressors. Then also help the patient socialize. Help the patient socialize. For example, depressed people. Depressed people, they always like to be alone. They don't want to socialize with other people. But as you continue with your relationship with that kind of a person and they start entrusting you, they will start changing on their behaviors, and they will at least start to associate with other people slowly. So you have to help them to associate with the environment surrounding them, and also help them to develop insight. Help them to develop insight. Let them understand deeply about how things move. Then also explain to them that they have a significant role in the treatment. By considering their decisions, this one will help them to adhere to treatment, because they feel themselves they are also part of treatment. So there's no way they can refuse treatment. Then also validate the problems and find the solution. As you continuously meet the client, always ask if there are new, try to find out if there are new problems coming up as you continue with the relationship. For example, you may reach in the middle of the relationship and the patient is no longer liking you. Maybe you have done something small and you think you have ignored it. You think it is okay, but someone has taken it serious. So you have to keep on identifying those problems that may arise within the relationship, also allow the patient to identify their behavior changes by evaluating themselves. For example, if there's someone who was depressed and didn't want to socialize with other people, didn't want to eat because he knew that he was going to die in the next few days, but now he can eat happily, he can talk to other people freely, there he can know that he's also improving. So that self-evaluation is very important. Always allow them to evaluate themselves and identify their behavior changes. Then the last phase is termination phase. This is the most difficult phase, but it is important because you may make a very nice relationship with a patient and it almost even turns into a personal relationship, not even only a therapeutic relationship, but also turns into a personal relationship. Now, in termination phase, this is where you are trying to bring the relationship to an end. Here, the patient will feel kind of disappointment because they are used to you. You may find the patient doesn't trust any person from home, but they trust you. Now you come abruptly, you tell them the relationship is coming to an end. They will feel kind of disappointment. They will feel a bit depressed. They will feel sad. But you have to look for the way of handling all those situations that may arise during termination phase. So, the main tasks of a nurse here are you explain to the patient that the treatment has come to an end, the goals were met, so it is time to separate. It is time to terminate the relationship. And then secondly, you review the feelings, emotions about the relationship. Let the patient explain to you how was the relationship, how was she handled, share that background of the relationship. Then thirdly, evaluate the effectiveness of the therapy. Find out whether the therapy has been effective. Find out whether all the goals have been met or others have been met, others have not been met. So find out the effectiveness of the therapy. Then lastly, discuss with the client about the future meeting. Discuss with the client about the future meeting if necessary. These are the 4 phases of nurse-patient relationship. Thank you for watching this video. Please don't forget to subscribe. This helps me to develop my account. And like, in case you have anything to share with me, please put it in the comment section. Thank you.